consistent invitation for about a half an hour for whoever's here, primarily doctors and medical professionals, to talk about the stories from the heart of their practice. We have to begin talking about what's going on and what's not working and what could work and where people are that are medical professionals. Our situation is really a juggernaut, and the people that work in the field essentially are subordinated to the routines and the requirements and the pressures and the instructions and the sanctions of the employer systems, which are more and more run by major large corporations, Dignity Health, Sutter Health, UC Davis, Kaiser, and beyond that. So we need to begin generating these stories in order to communicate with the press and to communicate with our patients and with our communities. And one of the things that we have not mobilized adequately for is to provide a group of physicians that are girded and comfortable and passionate to be able to attend your community organization meetings in order to fill the hole that a doctor needs to fill in order to talk about the vision of what's at stake for all of us. Okay?
I am Shiv Bhat. I'm a retired nephrologist. I practiced nephrology a little over 35 years. Out of that, 29 years in Merced as a solo nephrologist practicing in Merced. My story, there are 2 points I want to make. One is about the undocumented patients who have kidney diseases, who need care, pre-dialysis when they are chronic kidney patients, and then later when they are end-stage renal disease patients, they need dialysis and or transplantation. And undocumented patients, especially, they have health problems like diabetes, high blood pressure, and many other kinds of health problems that lead to kidney disease. And I had, when I was practicing in Merced, a young girl, she did not know that she had a kidney disease. So eventually she was not feeling well, kind of feeling tired, and many other complaints. Went to a clinic in Merced that's for farm workers, and in that clinic they worked her up and found she has chronic kidney disease. And she eventually was referred to me, and she had no insurance. I had to continue seeing her for a small amount of money she could pay me, and many times she didn't pay anything. But eventually, whenever she would get sick, because she could not come to me on a regular basis, she could get emergency medical, and she could then come and see me and take care of her acute problem. She eventually ended up on dialysis, and she had a friend or relative who was interested in donating a kidney for her, which I said is a good idea. And then there was no way she could get the kidney transplantation covered because she was on this emergency medical, which was providing this dialysis on as-needed basis. Eventually, she went on funding.
Online fundraising.
There was no online at that time. There was, internet was rudimentary, and so she spread the word in the community and collected. After 2, 3, 4 years of effort, she collected $10,000 or $12,000. She approached UC San Francisco, and somebody there said, "Yeah, we can go ahead and attempt to try to get you on emergency medical, this and that, and you need to come up with this much money." So even I donated $1,000 to her to help her out to go and get the kidney transplantation. Luckily, because she had a matching donor, live donor, UC San Francisco went ahead and did her transplant, and it was very successful, and she was a very happy person. So that's one of the stories I have. So that's why, we need a single payer type coverage which covers every human being that lives in California. So don't have to go fund me type, thing to collect money and do this. So, second thing I have to say to myself, I was, and I am still, a diabetic, type 2 diabetes for many years. And when I decided to quit my practice, you may want to call it retirement, but it was actually quitting my private practice, I did not think of health insurance. I had health insurance through my own business. I had a couple of dialysis units and my own practice, and I had many workers, employees working for me. So we had a medical coverage system, and that health insurance covered me too. But when that all disappeared, I did not apply immediately. If I had applied within 2 months to continue my health insurance, I would have gotten covered. I did not know, I did not think of it, and days went by. We were busy moving to this Sacramento area to Rocklin, and after we moved, we said, I need insurance. And when we go, nobody wanted to cover me. You have pre-existing condition, no insurance. So I had to go for several years without insurance, and one of my, these community insurance agencies, one of them suggested, why don't you apply for Mr. MIPS? That's medically high-risk people getting covered with the California state program. So I got covered through Mr. MIPS for another couple of years. Then I got my Medicare. Now I am covered. That's my story.